Most commonly, we use the tissue from the lower abdominal wall area, and this is the DIEP flap. However, there are instances where, for any number of reasons, that option may not be possible. When that situation arises, we look for other tissue options that will provide for healthy living tissue from the patient herself. One of those options is the so-called TUG flap, or TUG flap, and that stands for the Transverse Upper Gracilis flap. And what that means is we're going to take skin and fatty tissue from the upper inner thigh, and we're going to treat it just like we do the lower abdominal tissue from the DIEP flap. It's the same basic procedure. It's a transplant. So we're going to move that tissue from the upper inner thigh up to the chest area, and we're going to graft that tissue into a reconstructed breast, just as we do with the DIEP flap or any of the other tissue options that may be presented to you. The success rate with the TUG flap, as with all of the other tissue reconstructions that we do, is very, very high. The success rate is over 99%.
Usually, a muscle called the gracilis muscle is also taken with that flap. Now, the functional detriments of taking that muscle are negligible. Women do not notice that muscle being removed with that flap. Because of the tissue that's taken from the inner part of the thigh, the secondary benefit is also a thigh lift with the procedure.
PRMA is developing a national reputation for breast reconstruction.
Our national reputation is growing every year. People from all over the country are now coming to San Antonio to have their reconstructions done here due to the proficiency that we've been able to obtain over the years.
Doing the reconstruction, getting a woman back to feeling better and normal, I think helps to really fight the cancer and beat it.
I think one of the advantages we have at PRMA is that our entire staff is sensitive to the needs of breast cancer patients from the very beginning of their diagnosis to the very end of their treatment and then their ongoing follow-up. To be able to use that, use our skills to do that is quite a privilege.
From your very first visit until your very last, our nurses, our administrative staff, and our physicians will dedicate all of our energy to your care.